Hi, Robin. This is Phil Rusori. I'm dictating a short video about our project in Kenya. And this is what we had talked about before as far as getting a feature writer to do a piece on us. And the reason I'm timing it now is that our founder and CEO, Kajera Mugambi, will be in Northern California on October 3rd, 4th, and 5th. So that if a writer wanted to interview him while he was here in California, that could be done. So basically, what about this program? 18 years of a program in Africa that has been extremely successful, that's won some international awards, and I have been a member right from the beginning. 18 years, I've been the medical director. My background is in global health and internal medicine. For 23 years in the United States, I did intensive care and hospital internal medicine. And for the last 20 years, I've consulted and taught in the field of global health. So basically, when you look at what we have accomplished in Africa, there are three stories. One of them is what I call the Hollywood romantic story, which in our case happens to be true. This is a story of David killing Goliath, a story of, if you wish, a phoenix rising from the ashes of a village that was in trouble, and flying and expanding. And we'll go into that story in a second. The second story is a human interest story on our founder, who I met initially in 1985 in the United States. He was born in extreme poverty, almost died in childbirth in these villages that we are working in. At 14 or 15, came to the United States with from the aid of a missionary. Lived with 8 U.S. families, went to Santa Rosa Junior College, and then on to UCLA Law School, became a lawyer, passed the bar in the state of California, lived and practiced in Los Angeles, and many years later has returned to live full-time and work full-time as our CEO in this village, this poor village, the set of poor villages on the slopes of Mount Kenya in Kenya. And the third story, though, is probably the most important of all, and that is the story of how we have won these international grant competitions and why what we're doing for child maternal health in these 516 villages is actually revolutionary, why it's changing how potentially all of Kenya will handle child and maternal health. So let's start, well, by, if you wish, writing down the bones. What really happened in an abbreviated form? Well, I met him initially in 85. I went to these set of villages in 1987. Initially, everything that we tried really did not work. By the year 2000, we had no programs. It was Village HopeCore International, was a name on a piece of paper. He returned to the United States bearing very bad news that the village that he was born in, the village that I had visited, was being hit extremely hard by HIV. There was no antiretroviral medications at that time available. People were dying every week. The main street of the town was basically filled with coffin sellers. Air of despair hung over everybody. And it was out of that, out of the ashes of that, that he and I, in the year 2000, decided one more time to attempt something. So on an unrecorded day in 2000, I flew back to Africa, and in one dusty hot afternoon, Kajera and myself met with 12 poor village women and began Village HopeCore International with $5,000. A very inauspicious beginning. Obviously, many people have thought little chance of success, even though we were telling those women that if they were successful, that they could change how health and development was done in their area. If we flash forward now to 2018 to today, that's exactly what happened, because those 12 women have now become over 100,000 women and children that we offer health services to. They live in 516 villages now on the slopes of Mount Kenya. Our budget has grown from $5,000 to about $900,000 a year. We now have 100 employees in the organization, 70 of which are in my public health program, as I am the medical director for the public health program. And we have now trained historically 228 teachers and headmasters in the school system to be, in a sense, community health workers within each of the 200 schools we work in. So we have had a number of firsts. We were the first school district in all of Kenya to have us put clean, treated drinking water systems into all the schools. We also put hand washing with soap in all the schools. That had never been done before. We also have given each entering class, which would basically be the equivalent to our kindergarten, a 5-year treated bed net as protection against malaria, and we have put over 20,000 of those nets into our community, far and above any of the greater nonprofits that have been working there. We also were the first microenterprise bank to offer loans to HIV positive individuals, which was a success. So for a small organization, we have done quite a bit. But really things changed in 2016 for us when we became basically peer reviewed. Then what happened is that we entered an international grant competition online that was open to any nonprofit, that was open to any university, and it was there were 430 some applications, including applications from many nonprofits much larger than ourselves, as well as universities. There was one from Cornell, there was one from Johns Hopkins School of Public Health, major players. And out of the 430 applications, Village HopeCore International won for its innovative child maternal health program, which is pretty stunning for a very small program that nobody has ever heard of. And so that really will bring us then to the third part of our story of why we are doing revolutionary things in East Africa. But before we get there, I'd like to look at the second story, which is really the human interest story of our founder, Kajira Mugambi. Because what I see, and at one point in my life, I would have probably written an article like this, I see that the human interest story of the hospital, if you wish, the Hollywood story, which I just went over, this kind of David growing up to killing Goliath, this kind of phoenix that rises out of the ashes in an improbable way and becomes successful. That combined with the story that I'm going to tell in a second, which is the human interest story of one individual, I think those two stories can be the reason why somebody would want to read this article, while they would enjoy this article, and they support then the third story of why this is important, why this is changing healthcare in Kenya and potentially all of East Africa. So the human interest story really begins with Kajira Mugambi being born in this village that he's now living at in Chogoria, Kenya, probably 70 years ago. He doesn't really know the date of his birth. He was born in abject poverty, in a dirt floor, very, very humble home, which I actually visited in 1987. He almost died at childbirth, and luckily his mother and he were brought to the hospital, the missionary hospital that we still work with, and survived. It's one of the reasons he's been such a great supporter of my child maternal health program. And at the age of 14, with the help of a missionary, he was able to come to the United States. He did high school here. He lived with 8 U.S. families, working odd jobs. He went to Santa Rosa Junior College for 2 years. Did well, got a scholarship to UCLA, then a scholarship to UCLA Law School, then passed the California board and became an American citizen as well as a Kenyan citizen, and lived for many years in Los Angeles. And after many of years of living and practicing there, has returned to the village of his birth, Chogoria, Kenya, where he lives today. He is our CEO, our founder. He has been my colleague in this for 18 years. He is passionate about returning some of the benefits that he found in the United States to the same people, his Wameru tribal group that lives in this area. He basically works for a fifth or maybe even less of the salary that he could garner in the United States. Instead of living in his home in the United States, he lives in a one-bedroom apartment in the village and has made great sacrifices to keep this project alive and growing over the last 18 years. It's been a privilege for me to work with him for 18 years, and without him in the village, I would have never attempted this. So I think that the human interest story of a man born out of poverty, coming to the United States, then receiving an education, even becoming a citizen, and then returning after so many years to live in that poor village and to attempt to change what's going on there. That's a story that's probably 1 in 10,000 people, maybe 1 in 100 who come from that background actually end up doing. The third story, the revolutionary story, is what have we accomplished in delivering child maternal health? Why do we win these awards, this particular grant award for $100,000 over universities like Cornell and Johns Hopkins and large nonprofits? Well, basically, what we have done is we have focused on the fact that the basic biological unit in the developing world for the poor of the world, which we define as the critically poor of the world, of which there's about 2.5 billion people that fit that category. That's about 1 out of every 3 people that walk the planet. And for those particular people, the biological unit that's so incredibly important is a healthy mother raising a healthy child, that mother-child unit. And that's what we're going to focus our whole program on. And of course, if you do that, for a couple of generations, you have healthy women raising healthy children, you end up with healthy men, healthy women, healthy boys, healthy girls. And that is the unit then that when resources are lacking, which we want to focus on. Our microenterprise bank has focused on them for now 18 years. We have a consistent repayment rate over 94%, higher than home repayment rates in the United States. And our child maternal health program has obviously won these international awards. Basically what we're doing is we're taking medical technology, which really resides, if you look, for 30 years I've been traveling the developing world and consulting on programs in global health. And basically, if you look all over the developing world, you find that the medical personnel, the medical technology, the medical expertise is all focused in the Ministry of Health and their institutions. These would be the hospitals, the clinics, the outreach programs. Unfortunately, the women and children tend not to frequent those areas. In fact, they tend to actually avoid them. And the reason simply is they're afraid, number one, of having their meager life savings wiped out by going to these institutions, as they've heard frequently some very bad stories about what's going on. And also they're really unaware of what these institutions have to offer them. And many times, and over the years, my start was to send my residents, my global health fellows, into these clinics and hospitals. And one of the big questions always came back: why do they wait so long to bring their children in when they could have been treated as an outpatient a few days before with $1 of medication? Now they're going to come in the hospital, potentially be in our ICU for a week, and spend thousands and thousands of dollars, medical dollars, of funds that are very, very sparse and are very precious in the developing world. So what we have done then is we have taken medical technologies, particularly child survival technologies and family planning, and moved that into a whole school system. A school system of 200 schools, 45,000 children, about 132 elementary schools, and the rest secondary schools. And we've created a child maternal health program that is comprehensive and longitudinal. It basically takes in a woman then becomes a part of our program if she wishes when she conceives of her child at the first time, And then we would follow her and her child with our services for 18 years of age. So that is through the rest of her pregnancy, through delivery, through the first year of life, through the preschool years, and then on through until the child becomes an adult at 18 years old. So our child maternal health program, then run through the schools, is broken up to 4 parts. An infant maternal health program, which covers her from as soon as she knows that she's pregnant to when her child becomes 1 year of age. This is the most critical time for both the mother and the child, as this is when the maternal mortality in Kenya is about 14 to 15 times higher than in the United States, and infant mortality is about 10 times higher also. So that's our infant maternal health program. And then from 1 to 5, we see the mothers as part, the mothers and the children as part of our preschool maternal health program. And then from 5 to 12, we see the school children in the schools, giving them treatment and health education from the ages of 5 to the ages of 12. And then from 12 to 18, adolescence, defined as the time between puberty and adulthood. We also follow and give those children and those young adults training in mothers-to-be, sexually transmitted disease prevention, unwanted pregnancy prevention, and that has been extremely successful for us. So the exact things we do medically is actually my field, and I'm going to try to stay away from that in this presentation because it will go on forever, because that I have been the main architect of this program and would be more than happy to talk to any writer in detail of why this is so revolutionary. We're the only ones doing it in Kenya, and to understand the importance is to realize that in the California school system, it's a massive system with 6 million students, tens of thousands of teachers, thousands of schools, massive educational system. And yet the Kenyan system is 2 times larger right now than the US California system with 12 million students. And the important thing is that in mid-century 2050, there will be 24 million students. And Kenya population will grow. When I went there for the first time in '87, it was 18 million. When I was there last month, it had grown to 46 million. In 2050, it is projected to grow to 80 to 90 million people, and half of those will be under reproductive age, and most of those will be in what would be our program. So a program that presents education and healthcare and basic modalities like sanitation and soap and clean water and good nutrition and family planning methods to the mothers involved, then become very, very efficient to try to deal with this tsunami of women and children that are hitting Kenya and many, many countries in the developing world. The last thing I think we need to talk about is, as far as the programmatics go, is authenticity. Because I think any writer is going to need to look at that. And certainly what happened with the 3 Cups of Tea book is a good example of that. So in our case, I know Robin, you know our board member, Louis Jordan, you know his wife Linda, you know Barbara Bosman Moss, who was our board member for many years. You've known me over a period of time, and certainly you can give a writer at least a basic sense of the integrity of the people that are working in this program. Obviously, we have internal audits, we have external audits that show where the money goes. But when I was doing my consulting, I would always look at the leaders of the program as the final arbiter of whether these programs are really authentic in the developing world. In the case of Kajera, he's given up a huge difference in lifestyle from how he lived in Southern California to where he lives now, both in terms of salary, living conditions, etc. And certainly he has to be commended for that. As far as I'm concerned, and the rest of our very committed board, none of us take a salary. All the work that we do and have done for Village HopeCore is completely done pro bono. We don't take traveling costs, we take no kind of salary, we pay our own way when we go to the villages, and all of us, the whole board, has been to the villages. So we are committed and passionate about what's going on. And when you have leaders like that, then you almost can be certain that they're not going to put up with people who are misusing funds within the organization. So we're very focused on being sure that every dollar goes to the people that needs it. And because of the fact that we have this very committed and passionate and generous board, we have no cost in the United States. Our office here, our secretarial help, our internet, all that is covered. We have a few things like board insurance, but basically out of $100 that we take in for Village HopeCore International, $99 plus is spent in Kenya. None of us get paid, and there are really almost no cost here in the United States. And in over 30 years now of consulting in the developing world, we may be one of the few organizations in the world that can make that statement, that all the money we get is spent in the developing world. So why then should a writer be interested in this, and why should a newspaper be interested in it? Well, number one, as you well know, most of the publicity of Africa, 90% of it over the years, and I read all the articles about Africa, is always negative. So certainly this points out to be something that is successful, that is working, that is hopeful, and that has gone on for 18 years. So that it's not something that we hope to do. It's something that is being done right now. We have 7 foundations that support us, and our budget now is about $900,000 a year. But if we're going to go to that next level, we need to step up and get enough money to be able to expand. We've already expanded from 12 women to over 100,000, but now we have to look to expand into the millions of women. And to do that, we need to access some large grantors and foundations, the type of people who would be found in Silicon Valley. So that is our motivation for doing it, and also to get these ideas out so that other people can clone what we're doing and try them in different parts of the world. The other thing that it does is, as you're, I'm sure, well aware of, and your writers are well aware, that sweeping the country right now is kind of this narcissism, this isolationism, this America first, which in many ways is a thinly veiled me first kind of conception of our existence, feeling that these are S-hole countries, that these are countries that are hopeless, and that the people living in them then are, the implication is at least, that the people living in them are also hopeless and should not be helped. And obviously we represent a much different view of the fact that if we're going to have a healthy future for our children and a safe world for our children to live in, then we need to balance this planet as far as these inequities of health care, etc. So my granddaughter will be 34 years old in 2050. And so even though I won't see 2050, she's going to be at the prime of her life. And I think that those of us then who are the stewards of what's going on right now need to be cognizant of that. And our work has to focus to make 2050 a much better situation, particularly in the developing world and in countries like Kenya. So I would be more than happy to work with any writer who's interested in this. I teach global health and international health. This is what I do. Kajira will be here in October. He can be interviewed at any time over Skype. We can put the writer in Skype contact with the district officer of education who runs our school system. We have an official signed and stamped letter from the school system that defines everything that we've done for it. I'll just read you the last 2 sentences we close. Through your support, the sub-county has seen improved hygiene and good health among our pupils. This has impacted positively in enrollment, which has increased significantly. The national performance in our testing has also improved compared to the other sub-counties in Maranithi. The Education Office in the sub-county pledges to continue with the cooperation and collaboration to ensure that both the ministry and HopeCore achieve their objectives individually and collectively. So we can document the award that we won. So I would greatly appreciate if you could try to get this into the right hands. I think that this could be a win for a newspaper. It could be a win for a creative young writer who's willing to take on this challenge. And it certainly will be a win for the women and children of Chogoria, Kenya, and these 516 villages. So thank you. So Robin, I will email you this and the contact. My cell phone number, I'm here in Northern California, is 707-583-5662. My email is prasori@aol.com. I would be more than happy to talk to anybody and any writer about this particular project and help them move through it. So again, Robin, thank you very much for your support in this, and I look forward to moving this ahead.